A couple strategies that you can use for the endo exam is to get your pencil. Depending on the location, you may have to wrap this in some sort of barrier before you can use it in the mouth. And then you can trace along the marginal ridge and kind of just, and along the incisal edge, and create an outline. What this does is it makes a very, very easy location to measure from. And you're gonna want at least 2 millimeters from the incisal. You're gonna want 1 millimeter from each marginal ridge, and at least 3 to 4 millimeters from the base. Once you do that, what I did on my exam is I had the markings all the way around. I measured in, drew a triangle, and then just drilled out that triangle. I used a diamond KR6847, just because that's what I'm used to using. It's recommended that you use a round 4 because then you can feel the drop as you enter into the chamber. What I found was kind of difficult with using an endo round 4 at a high speed is because this tooth is a little more brittle. When you touch it with the endo round 4, the speed can cause it to kind of almost shatter in a circular pattern right around the center. And if it shatters and you go past the 2 millimeter requirement or the 1 millimeter requirements on the marginal ridges, then you're in trouble. So as long as you have reasonable hand control and you're able to go very slowly into the chamber, I would recommend using a diamond so you have a cleaner cut. That way you don't have to worry about, you know, a high-speed round burr just expanding a couple millimeters incisally, mesially, or distally and getting you into trouble. So once you open up the chamber, and you have everything marked, you know that you have enough space. You're gonna want to check and find out where the pulp horns are exiting, and you're gonna want that to be a smooth exit. You're gonna want to clear out all of the pulp inside, and you're gonna want to be able to take your explorer and just drop it straight in without feeling ledging. A lot of people have incredible hand skills. They can just take their round 4 and just excavate everything and create the access just nice and smooth. I'm a little more risk averse when I'm taking an exam, so I do things a little differently than I would do in clinic. So I tend to rely a lot on an endo zebra to kind of create a smooth line access down the floor. I tend to use a 6847, the Cara green, in order to almost hand file my access, and also to hand file a way down into the chamber. It kind of takes a lot of the errors away from when you're using a high-speed handpiece and your hand moves a little too quickly and you get a ditching, or when you're using a high-speed handpiece and you overextend. That's very easy because you're going fast. So if you'd like to just be a little more careful, you can just take your handpiece, put your KR green or any other coarse diamond burr, put it into your tooth, and just hand file your way into the proper access that you would like. You can also take the same thing, use it to scrub your walls. Make sure they're nice and clean and smooth. And also, being very careful not to hit the incisal edge, you can take it, just push straight down, and file a nice smooth access. Very similar thing for number 14. You want to draw along the outside of your tooth. Because you know you'll need to be 2 millimeters from the mesial, 1 millimeter from this groove here, 1 millimeter from this cusp tip, and 1 millimeter from this side here. You can do the same thing. You know, once you make your access, let me see this one. Here's a new one. Just get that marked. So measure your distances, memorize where it is on the tooth. On this particular tooth, you can see, let me see if I can get this zoomed in just a little bit more. You're going to have a canal here, here, and just under here. So by looking at the anatomy, you can see there's a slight depression right here, slight depression here, slight depression here. And then you can just go ahead and draw your triangle. And of course, it's a little more difficult upside down and inside the mouth with the mirror, but with a little bit of practice, it becomes normal. So once you draw your triangle, just take your burr, drop it in, clean it up just a little bit. You always want to make sure you have a little bit of pencil mark around the outside so you don't encroach on any of the required measurements.